Have you ever wondered why some skin always look fresh, young and supple, as if we have just come out of the loo without any makeup and all that? They still look like a baby skin. Yes, this has been made possible by one newer scientific technique, by the use of PDRN or Polydeoxyribonucleotide, which have left behind Botox fillers and threads in race towards the anti-aging, as they really form the pillars of modern regenerative medicines, which help to generate the lost collagen, which goes normally with time. It disintegrates with the time and it never gets replenished. So we must know what exactly is PDRN. PDRN in full form is polydeoxyribonucleotide, which is compound which helps in the cellular metabolism, improves the cell repair, increases the collagen production, and tries to regenerate the dead cells. So this is nothing new. But then this has been used for a long time in ulcers, non-healing ulcers, non-improving scars, as well as in many other forms of treatments. But suddenly it has found a good use in the modern regenerative dermatology because it biomodels the collagen and produces the collagen formation by stimulating the cell metabolism. So to that extent that it has a big promise for the future, it has left behind our Botox fillers and threads in the form of anti-aging treatments. It is really going to be one of the topmost things in the years to come. Let's understand how do the PDRN work. As we age, our cellular metabolism also slows down. The destructive process overtakes the constructive process. This is where the PDRN works. It accelerates the regenerative part of a cell by improving its metabolism, by formation of new tissue, and enhancing the collagen and elastin support. To a larger extent, improves the micro blood circulation at the cellular levels, which is a hallmark of a cell regeneration. In simple words, it teaches the old fatigued cellular cells to behave in a young, smarter way. So this is what we want, and this is what forms the basis of anti-aging treatment. Let's talk about the key benefits what PDRN therapy is going to give. First and foremost is that it reduces the fine lines and wrinkles by increasing the collagen biomodeling and reproduction. Also, it hydrates the skin from within, not from the outside, what most of the moisturizers do, but it gives them a good hydration within the cells also. It brightens the skin tone and it fades the acne scars. It also helps in the faster post-treatment healing following invasive lasers and any other treatments with the RF also imparted to the skin. The healing is much faster with resultant least scar. Also, it remains one of the best choices for a pore enlargement, what normally people do get after the acne healing. Who are the ideal candidates for PDRN therapy? Candidates with very dull, tired skin, lusterless skin, any other person with no glow kind of a thing, or who have premature appearance of the wrinkles, fine wrinkles and lines. Also, persons with the open pores, persons suffering from rosacea and untreatable melasma, and also with a dehydrated skin and a loose skin, they form a good candidates. Also, other than the skin, if you want a faster healing after the aesthetic treatments, PDRN will be a very good support for such faster healing. Before we go to start the PDRN therapy procedure, it is pertinent to note that it is safe for all kind of skins, be it sensitive, be it one which is very acne prone, or be it one which results into any procedure resulting into a bad scar. So it remains one of the absolutely least toxic to the skin outcome kind of a treatment. So we discuss very blatantly how to perform the PDRN. These comes in a pre-filled syringes It can be either imparted through very thin needle in a intradermal injections, or by the using derma pen, or by using derma roller, as it only has to be deposited in the dermal plane, nothing short of it. A numbing cream numbs the whole skin for the procedure. Say about 25 to 30 minutes is good enough, and then we make a grid in which 1 centimeter apart we inject those injections, so that in due course of time it fills up the whole face or the neck or the hands which need your attention. The best part about the treatment is that it has hardly any downtime. It may leave you with a little red skin, but with no resultant and residual scar beyond 24 hours. That is why it is a very, very popular lunchtime procedure. You come from your office during lunchtime, get it done, and go back and join your office without anybody noticing that you've undergone something. PDRN sessions, normally the treatment consists of 3 to 4 sessions spaced at 3 to 4 weeks apart, and we do require 3 to 4 sessions. At the same time, the main aftercare is the liberal use of sun protection cream with adequate SPF, at least of 35 to 50 SPF. And the best part of the treatment is that it does not do anything but repairs your own skin with your own cells. So this is a unique in its own form, and I am sure it has a very, very long way to go. Healthy skin is not about forcing change. It's about supporting your natural repair. And this is where the PDRN comes in a very handy way. Thank you for your watching. Stay confident and stay healthy and enjoy your skin health.